Dari, Mitch, and Ted. We welcome to the show cosmetic surgeon, Dr. James Chan.
Now, Dr. Chan, I have a friend. I'm not going to say who she is or anything like this, but years ago, I mean, I'm going to say 12 or 15 years ago, she had gained some weight and she wanted it gone in a hurry with help. So this was before lap band surgery was done much, if at all, in the United States. But they in, I think it was Brazil or maybe even like a Slavic Soviet country. I don't remember where it was exactly. But they were like, sure, come on, we do it for cheap. Come get.
Oh, no.
So, and I was terrified for her. I thought first of all, she wasn't even that overweight. And she went and it was just terrifying.
Oh, no.
She went and she had it done and she came back and she had so many complications. She had this intense bacterial infection. Because the environment was not as clean and hygienic as you would find in, I guess I don't want to say real hospital, but I guess by American standards. And the material they used was kind of wonky, like it wasn't, it sort of dissolved. And she finally did end up getting it corrected, but it ended up costing many, many, many times over the amount that she thought she would save by going to the foreign country, and just the pain and stress that that all the infections and all the things she had to go through. She eventually did lose a bunch of weight.
Well, see, it
With all
worked.
that stress,
Success.
and couldn't afford food anymore.
Crazy. So
That's
my
awful.
question is, a lot of times you'll hear about different procedures like I'm thinking like butt implants.
That's
You'll
a
say
big
like,
one.
do you do butt implants? And they're like, no, but over in this country they do them, and people are like, I'll just go to that country and get them done. Why is this not a great idea?
Yeah, so I can't begin to tell you how many times a week I hear from patients that have gone somewhere else to get some stuff done or are thinking about going somewhere else to get stuff done. It's crazy. It's several times a week. And then you ask them, what did you have done? What was injected in your face? And they don't know. They have
Oh,
no
my
idea.
gosh.
It was a substance. It was in a different language. But the doctor or person dressed in doctor outfit assured me, I think, that it was fine.
Have you
Yeah.
ever tried easy cheese?
Is the reason always because of price?
It's almost always price. I mean,
ooh.
that's the reason. And then they try to sell you on this allure of, going somewhere to a resort.
It's an
and
exotic
recovering.
vacation where you can get some plastic surgery and then go home rested and relaxed with a brand new
Right.
you.
But the reality is, if you're having plastic surgery, you're not going to be sitting out on the beach and recovering. You want to be recovering in bed.
Yeah.
And if you're going to be in bed, you might as well be at home. So. Going back to your friend's issue, the standards that are used in other countries in terms of sterilization and accreditation and all that are much different. You have no idea whether they meet the same standards as we use here in the United States. And that's why it's so much more expensive here, because we have all this regulation. But it's there to...
scalpel, Dunkin' mouthwash.
but it is there to ensure that patients are safe and that the equipment that we use is sterile and all the supplies are sterile. I mean, there's stuff that other countries consider okay, like certain practices such as sterilizing needles and sutures and
This
gloves.
needle not new, but I ran lighter over it.
Yeah, we would never do that here. I mean, that's just not sterile. But other countries feel that that's acceptable. And
do other countries have boards looking over the doctors and making sure they're accredited and properly?
Some do and some don't.
So you just
and
don't
it's
know.
highly variable. And even if the doctor is good, I mean, there are some excellent international doctors. You don't know about the nurses. You don't know about the facility. You don't know about, the supplies they use. Is it FDA regulated? They don't have an FDA, so is it regulated in
You
any
don't know
way?
about Coffee McGee, the phlegm-filled janitor? He's
right.
through that room all the time.
And you can't go back to that doctor for follow-up, probably for financial reasons.
Yeah, so follow-up is a big issue. I mean, in an ideal world, plastic surgery goes perfectly fine. You never need to see your doctor again.
And also I can fly.
Right. But,
In a perfect world.
statistically, and unfortunately, medicine's not a perfect science, and with any surgery, there's going to be complications and risks and all that stuff. So you do need that follow-up care. And if you're thousands of miles away from the person who did your surgery, you're kind of in trouble. And like Daria alluded to, if you then go to someone here to get that corrected, it's probably going to cost you twice as much.
Because they got to undo what was done and then redo
Exactly.
it correctly. Yeah.
So I have a question. I'm hopefully going to phrase it in an understandable way. Just like you with say a driver's license, that you may be driving around with a driver's license, but maybe you're 80 and you got that driver's license when you were 35. Doesn't necessarily, the fact that you have a license doesn't necessarily mean you're the best driver and I want you right behind me.
So just because you're a licensed doctor somewhere.
How
yeah.
can you tell if a doctor, plastic surgeon has, and I just happen to know this about you, that you continue training throughout your career, that you got initially certified, but then when new products and procedures get on the market, you go and you do training and you do lessons and education and seminars about that until you're up to date with new procedures. How do I know if a doctor has done that or not?
Good question.
Is there any way to know?
Yeah, so the board certification process in the United States requires that we do a certain amount of continuing medical education. Also, our state licensing requires that. So we have a couple of certifying bodies. And then on top of that, and this is something that's, I think, very important, if you go and see a doctor here, you want to know if they have hospital privileges, because if they have hospital privileges, the hospital will certify whether that doctor is qualified to do those procedures in their hospital. If you go to a doctor who only operates out of their own office and there's no, facility that they're using, there's no other certification, you don't know if they're qualified to do that procedure in the office, and there's no oversight. So that's why it's very important that if you go to a doctor, you should ask, are you qualified to do that procedure in a hospital? Are you certified to do it in a hospital? Because if you are, that means that they've met a certain standard.
I had no idea.
I had no idea either. That's a great thing
That's
to know.
really good information.
It is. It's very important, and people overlook that. And that's why you get, if you're a doctor, you technically can practice any aspect of medicine, but you're not going to come to me to do brain surgery. And a hospital would never give me privileges in their hospital to do brain surgery.
But think about how pretty my brain would be.
Oh my gosh, gorgeous. Is your brain saggy and wrinkly and starting to get crepey around the edges? There's no cure for a saggy, crepey brain, but you can roll years back.
Right.
Dr. James Chan is a plastic surgeon that specializes in the area of the face. He's also a fully certified ear, nose, and throat, which lends itself to just medical soundness along with all the different rhinoplasty, et cetera, procedures.
Double board certified.
Check him out at drjameschan.com. Thanks, Doc.
Thank you.